Good to have you with us for Local 4 News at 5. At a news conference a short while ago, President Trump announced new guidelines aimed at slowing the spread of the coronavirus.
This comes as the president believes this pandemic could be over by July or even August. It's being called 15 days to slow the spread. Let's go ahead and break it down for you. Simply put, if you are sick, stay home. If someone in your family is tested positive in your house, stay home, even if you are not sick. Avoid groups of 10 people or more, and most of all, practice good hygiene. The health experts say these guidelines will save lives and buy time for scientists and doctors.
We hope that the people of the United States will take them very seriously, because they will fail if people don't adhere to them. We have to have, as a whole country, cooperate and collaborate to make sure these get done.
There is special concern about convincing millennials to stay home and limit contact.
Now, why do I think the millennials are the key? Because they're the ones that are out and about. And they're the most likely to be in social gatherings. And they're the most likely to be the least symptomatic. And I think we've always heard about the greatest generation. We're protecting the greatest generation right now, and the children of the greatest generation.
But they acknowledge many millennials are not hearing the message from public health officials.
But millennials can speak to one another about how important it is in this moment.
There was progress to report on the vaccine, with the first tests now underway.
The vaccine candidate that was given the first injections for the first person took place today. You might recall when we first started, I said it would be 2 to 3 months, and if we did that, that would be the fastest we've ever gone from obtaining the sequence to being able to do a phase 1 trial. This has been now 65 days, which I believe is the record.
But there is still widespread concern about testing backlogs.
We need to make sure that we've got the ability to make all the tests, to run the tests, and to get results in real time.
And the need to slow the spread of cases now.
There is no healthcare system in the country that is capable of handling what would be a tsunami of cases that we've seen in Italy and other countries.